Hey, I'm Skibo Holman. I'm a physical therapist here with McElroy Trucking, and I want to talk to you about something I see a good bit in my clinic. It's chronic low back pain. Chronic low back pain is different than acute low back pain. Chronic low back pain is something you have. Maybe you've had it for a few years. Kind of gets aggravated about over a period of a day or two. You come into the clinic and say, I don't really know what happened. It's always bothered me, but now it's really bothering me a lot. A lot of times that comes from a muscle imbalance. Now, actually, I see this the most in occupations like truck drivers, accountants, anybody that has to sit for long periods of time, get up and do intermittent types of work, go sit back down. Here's what happens. Your hip flexors are a muscle that runs from the inside of your thigh through your pelvis and attaches to your lower back. They get really tight when you sit for long periods of time. Then you have to stand up. They're attached to your lower back. So they begin to put stress on your lower back that's abnormal. Your hamstrings run from the bottom of your leg all the way up to the bottom of your pelvis. They get tight as well. You get up, all of a sudden they're pulling your pelvis forward. Your hip flexors are pulling your lower back forward. You start having pain. So when someone comes in, first thing I check with chronic low back pain, hamstrings, hip flexor tightness. All right. Usually they're tight. I ask them, do you stretch? They say, sure, I stretch all the time. Here's how they usually stretch. How do you stretch your hamstrings? All right, well, they'll throw their leg up on something, reach forward. This is how I stretch my hamstrings. Now, this is a good stretch. Nothing wrong with this stretch. But here's the problem. I can make you think I'm stretching my hamstrings when what I'm really stretching is my lower back. All right, so if I take my lower back out of that and I reach, that's as far as I can go. I'm pretty tight in my hamstrings, okay? So people fool themselves into thinking they're stretching hamstrings when they're really stretching other things. What I want to show you is the correct way to stretch just hamstrings. And I put almost all of my truck drivers on this. It doesn't matter if it's flatbed truck driver, container truck driver, any kind of driver for that matter. All right, simple. Get a strap. You're going to lay down on the floor on your back. And you can do this in your bunk. You can do this at home. You can do this anywhere you want. Put the strap around your foot. Lay all the way back. Make sure your knee is fully extended. Make sure your foot is back. Now, when I pull my leg up, that is all hamstrings. Nothing but hamstrings. That's as far as I can go. So here's how you do it. 3 seconds, I stretch as hard as I can stretch. Then I bend my knee just a little bit. It takes a stretch off. 3 seconds off. 3 seconds on. 3 seconds off. 3 seconds on. Now, if I do that for a whole commercial break when I'm watching TV, I got that leg stretched out. The next commercial break, I do the other leg. I got it whipped. Okay, so that's my hamstring stretch. The second stretch I show people is a hip flexor stretch. Now, a hip flexor stretch, you can do standing up anywhere. Hold on to something so you don't lose your balance. And it starts out as a quad stretch, which you've probably seen. This is a quad stretch. Bring your heel towards your rear end. Now, this is not a hip flexor stretch. There's nothing wrong with this stretch either. It's a good stretch to do. But to add your hip flexor to it, you start here and you push your knee back. That I feel right there in the hip flexor. This stretch you can hold for 3 minutes. You don't have to let off. This is a hard muscle to stretch, but it's an important muscle to stretch. And it's one of the primary causes of chronic low back pain. Now, when I have a patient come in with chronic low back pain, I can put them on those 2 stretches, and I would say around 80% of them get better with no other intervention. All right. Sometimes it takes more. Those 2 are my primary go-to stretches for anybody that has to do long periods of sitting.